Hi. Good morning, Ash.
Good morning.
Afternoon. Oh, it's already afternoon.
How are you?
Good day outside. I'm pretty relaxed. I know there's a polar vortex or some other storm coming, but until then, it's nice out.
Thank you so much for taking the time to chat. It really means a lot.
Thanks for reaching out. Really impressed that you took the initiative on that, and happy to talk about some of the stuff that's happened in the past month or so.
Great.
Get my screen. Yeah.
You want to start off by explaining the work that you're doing at Penn-Health Tech and Project Shields and how exactly you're leading the fight against COVID-19?
Yeah.
Just kind of background on that.
Yeah, I'll start by actually introducing myself. So I'm Julia. I'm finishing up my master's in integrated product design at the University of Pennsylvania. And I also did my undergraduate degree at Penn. So I was kind of familiar with a lot of the Penn engineering professors, as well as what volunteers and what departments were on campus. So I was familiar with the organizational structure. So when COVID happened at the tail end of spring break, they actually extended it for a week. And I asked multiple times how I could get involved. But as you can guess, it was really crazy at the end of that time. And so I wasn't getting many responses. I ended up getting pulled in actually by a classmate who thought I could help and just kind of jumped in. And so Penn-Health Tech is is an interdisciplinary center launched in 2017 to advance medical device innovation across the Perelman School of Medicine and the School of Engineering and Applied Sciences. So it's this formal relationship between the School of Engineering that I was from and the School of Medicine that I had been doing some health-related projects work with. So they were the official partnership, and they really got off the ground very quickly, and I can talk a little bit more about that later. But within that first weekend, we were actively testing out different prototypes of face shields, face masks, ventilators, and different response efforts. On the separate side, there is a different initiative called Project Shields, and that's founded by 3 entrepreneurs who are all classmates of mine. So we were familiar with each other again before all of this had started. And we had talked at the beginning of this in mid-March. They took another week or two, started fundraising, putting in some high-volume manufacturing processes in place. And they actually kicked off a little after the Penn-Health Tech effort, but have done a lot since. So there are 2 separate efforts, but it was a very integrated effort. We were learning from each other throughout this process. Yeah.
So since there's so many response teams, like different response teams,
Yeah.
what are some of the projects that each team has been kind of working on? And like, how are you able to coordinate with one another?
Yeah, so the Penn-Health Tech effort was really nice because it offered a formal structure that we used for this response effort. And I think that was really nice to have that, the connections and the relationships are already there. So they had a lot of departments within the School of Engineering that actually took on different initiatives. So we did face masks, face shields, they were adapting ventilators, they were doing telehealth and robotics. So there were, I don't even know how many initiatives under the Penn-Health Tech umbrella, but those were being managed through existing relationships. Project Shields was created in response to COVID and took 3 entrepreneurs that just kind of ended up focusing on face shields as this high value activity that they could add, and focused on this one initiative and scaling that up to thousands of units per day. Right now they're at 3,500 units per day.
Got it. So how successful has your team been in meeting the needs of the medical community? And like, what are your goals for production from now on?
Yeah, so in the first weekend, I think Penn-Health Tech started on a Saturday. I joined on a Sunday. We, because of this formal partnership, we actually had been in constant communication with hospital leadership at Penn Med and the University of Pennsylvania Health Systems. And their original need for us was 10,000 units, and as soon as possible. So I think we forecasted 2 or 3 weeks. We ended up doing it in 3, but the original ask was just those 10,000 shields, and we hit 18,000 in 3 weeks.
Wow.
For the 5 UPHS hospitals. So that would have been HUP, Presby, Pennsylvania Hospital, Chester County, and Princeton. So we focused on the kind of internal, those hospitals, and serving their needs with dropping off thousands per those hospitals. Once that finished, we actually stopped and we transferred a lot of our volunteer effort, as well as some leftover materials and parts that could be used, over to Project Shields. So I brought that to Project Shields, and they had a slightly different mission. So instead of scaling up to target these specific hospitals, they're actually scaling up to deliver smaller units of smaller packages of face shields across the country. So the last impact report, I think we've delivered nearly 50,000 to 27 states. Which is, I know. So in the beginning, it was very local, but we've expanded that need generation effort to target places like nursing homes, which account for 1 out of 5 deaths in the US and 50% locally. So we've really spread that out, and it's a massive operation that really scaled up quickly. And that doesn't have an end in sight. We're trying to see what makes sense long term for that, but right now we're definitely just producing and shipping as much as we can.
Since the whole process has been kind of slowed down due to isolation restrictions, right? How are you able to kind of modify your products based on feedback from healthcare workers? And like, are there any challenges that you faced so far?
So many. So a lot of the prototyping and design work is iterative, which means you have to try it and get feedback if you want to have a useful product or something that will be used. And medical devices and anything in the healthcare space is you have to be extra careful, and it's covered by a lot of regulations and protocols. We didn't want to skip that, but also we were balancing that with the need for speed. So we did this recap where we talked about the timeline of the Penn-Health tech effort, and it was really insane. So the first weekend, we had the call, we got the estimated need and timeline, and we actually started prototyping. We had 3 in-house designs. So we went with all of them and kind of just scaled as we went to see which ones were more effective. But the first weekend, I'm not even kidding you, I made a face shield prototype off an open source design by the University of Wisconsin. I cut elastic from yoga pants. I had leftover foam from a different project, and the clear shield was from I think it was like nuts, like a gift pack or something. Like they have the clear, I think it's PTG, maybe it's PETG. It was some clear film thing. So I made that first version just so that we could get it into someone's hands to see if that would work, and validate it. And there were also someone 3D printing a design, and then someone laser cutting design. So we had these 3 in-house versions that as soon as we could, we got them in the hands of ED staff and supply chain, the Hospital of University of Pennsylvania supply chain leadership. And so we needed validation from frontline health workers that they could wear it, it would be comfortable, it would protect, it wouldn't fog up. These user considerations that were really important to us. And then we also needed the support from hospital leadership. So they needed to physically see the design, see doctors use it and approve it, and be able to have it cleanable and all those other details that needed to happen. And so that all happened with contactless pickup and drop off, which was insane. But the nice thing about Philadelphia, and another big benefit of us being where we are, is that we have this strong connection between the medical staff and the educators. We all live close by. It's a really tight network, and I was able to drive over to someone, less than a mile away from me, drop it off at the door. We would do a Zoom call for feedback and then iterate, and then we would do that again. So by the end of the first week, we had locked down 3 designs that we're pursuing, which was insanity. And like you said, the isolation restrictions were a really big issue. And so in response to that, we created an entire supply chain team and network. And what that was all organizational. We would just figure out pick-up drop-offs and then bring those rounds to a driver who would do that. There was quality control built in, there were suppliers, and then final delivery points. So that was in response to the inability to work together in the beginning, and that was really effective. I think we had over 150 pickup drop-offs last time I checked the form. So it was really moving everything online, which, I think all schoolwork and collaborative work, you have some habits of working online, but this was migrating even the planning of the physical movement of stuff onto this online work. So it slowed us down a little bit, but I think we pivoted and made the most of the time and stuff that we had.
Great. So what's been the greatest takeaway that you had from this entire experience? Has it brought you any closer to your Penn community?
Yeah, I think that's a great point. It was a community building effort. We had over 250 volunteers. I have all these facts. We just did this recap last week, but we had over 250 volunteers that volunteered without really knowing what we needed from them because we weren't sure. Things were changing, day by day, and we were nailing it down as we went. It brought me closer to my professors, my classmates, previous classmates, recent alumni. I reached out to anyone that I knew was capable, had the time and knew how things ran. And we built upon a lot of the informal networks and relationships that we already had. So you would pull together classmates from a specific class because you knew they understood manufacturing. Pull in professors that you knew had research students that couldn't do research because they didn't have research labs right now. And so we really built on that. And we crossed departments. We worked with the library system, we worked with bioengineering, we worked with the design school, like that, nursing school, med school, like it crossed all of those, which was really cool that we got this level of community building through this activity. Biggest takeaway is just like, if there's a will, you can make it happen. Time is irrelevant, like and there's a lot more that I think people can do despite everything. And I think there were a lot of success stories happening across the country. I think that was really amazing to feel part of a global effort to respond and protect the frontline health workers.
How could people support your initiative? Like, say someone doesn't go to Penn and isn't kind of involved in that process. How could they support you guys and what you're doing?
Yeah, I think part of it is always asking, like, what can you do to help, and finding out what an organization's current pain points are. So rather than jumping and being like, I can just do this, try to kind of figure out and ask around and see what's already happening. So one example is that out in the suburbs, Chester, I think, I've been talking to a woman that's been helping high schoolers get involved in these volunteer efforts. And so the Phoenixville Makers Group, Phoenixville Makes PPE, I forget what their title is, but they have a very organized effort, and that means that they can support a lot more volunteers. Early stages, when it's individuals, I think it's hard to band together, but if you have an existing organizational structure going and someone that can take the lead on making sure everything happens, then I would join existing efforts. So they have high schoolers that are helping 3D print, high schoolers that are helping pick up and drop off, high schoolers just helping assembly, quality control. So they're, it's kind of people from any level, any place, as long as they fit like a current need for that, they can help. That was one. From Project Shield side, you can go on the website, Project Shields, SHIELDS, projectshields.org.
I'll link it.
And you can request personal protective equipment or share the link with anyone in your network that you know is an essential organization and still open. So I've been cold calling nursing homes, asking if they could use it. There's I think just getting that message out, because we have a supply, but we also need to generate the need. And the organizations the hardest hit are the busiest and have the least time to find us. So we really want to find them. So that's, I think, the best way to help right now on our side.
So do you have any last words, something you want to share with people about your overall experience?
Oh, this is so quick. I think I think I was one of the first students to get involved on the Penn-Health tech side. And I asked multiple times how I could help, and that works, but usually that works really well. So people know what they need help with, but because everything was so new and we were moving so fast, I wasn't getting assigned any tasks. So I was kind of observing and seeing what needed to be done, and I ended up taking on one of the smaller units. So the face shield specifically, something that I knew that I could like own and show results on, and just kind of ran with that, brought in student volunteers and created this transportation and supply chain network. There's two ways. You can always wait for a task to be handed to you, or you can always ask and see, like, if I did this, would it be helpful, and take a more proactive approach. So I think that was definitely something that it's nice to know that worked out for me in this case, kind of, and it kind of taught me a lot in terms of leadership and managing volunteers and being able to take this task and run with it. That's be persistent. Sometimes no's are just because people are really busy and it takes time to come up with tasks that bring value, but you can always propose things or needs that you see. Yeah.
Great. Thank you so much for talking. I mean, I actually learned a lot from this conversation.
Any other off-the-cuff remarks or thoughts?
No, honestly, I'm really impressed by the work that you're doing at Penn. It's insane how productive you guys have been over the past few weeks.
And the Project Shield side, once again, no one asked for permission. I mean, it was 3 entrepreneurs that had an idea, and they're very much self-motivated and very passionate to making it happen. And they ran at it, and they've been continually running at it. So definitely a lot of amazing things. And I think a lot of people felt guilty in this beginning part where you're sitting at home and can't help. And I think that was another one, knowing that maybe at times we felt like we were creating more work for ourselves than we had time to deal with. But once we tapped into this volunteer network, you were realizing there's so much energy and goodwill towards helping. And it was kind of a win-win to get more people involved. So yeah, relying on others at times, delegating. If not, like, you can't move as fast.
You could see that. I mean, the progress that you guys made over the past few weeks is absolutely incredible.
Yeah, people responded to the calls. They really did. And that's a really powerful thing too. Yeah. Yeah, and if you have any other questions, let me send you some of the info on chat so that you can put it in the description or include some of that. Ongoing efforts. Yeah.
That would be amazing. Thank you so much. All right.
Thank you.
Bye.
Bye.